After successfully pivoting to a virtual oral health education program at the onset of the pandemic last year, Sonrisas Dental Health was hopeful that school campuses would be open again by the fall so that we could resume our school screenings on site. But when that didn't happen, Sonrisas adapted yet again and developed the drive-up format, which was extremely well received by the families and school administrators in the community. Fortunately, as school campuses started to open up again in the spring, we were able to coordinate screening events at 6 different school sites in a matter of weeks. Our objective was to make the process as easy as possible for school administrators who were already busy with COVID-related concerns. Of the 305 children that Sonrisas screened, 34% had active dental decay. Overall, 10% of the children needed urgent dental care, mostly due to dental infections and pain. The children we screened through the school screenings and drive-up dental screenings ranged in age from 14 months to 18 years old. We found that even teenagers presented with active dental decay and were having trouble finding a dentist to see them during this ongoing pandemic. The data showed that about 1/3 of the children we screened had dental decay across the age ranges. And for the older children, particularly the teenagers, this decay was affecting their permanent adult teeth, not just baby teeth anymore. Sadly, problems with adult teeth at a young age can lead to a domino effect of dental issues later in life, especially if not treated in a timely manner. At the drive-up dental screening events, we were able to ask the parents and caregivers directly when their children had last visited the dentist. We discovered that over half of these children had not seen the dentist within the last 12 months. Many families stated that they were finding it difficult to get appointments for their children or to find dentists who served patients with Medi-Cal coverage. At Sonrisas, we understand that screenings without intervention are not effective if the child does not have access to dental care. So follow-up care coordination is an important part of our outreach program. Our bilingual care coordinator contacts the parents of all the children that are seen at the schools, since the caregivers are usually not present at the time of the screening. For the families from the drive-up screening events who state they do not have a dental home, we assist them during the event or call them afterwards to see how we can help them find dental care. In the last few months, we've been able to help 46 children make appointments with the pediatric specialist at Sonrisas' dental centers. Some of these children were as old as 8 years old and had never seen the dentist before. Through our new programs this year, we made some interesting observations. The consistent care coordination definitely had a significant impact on helping families not only identify dental issues with their children, but also improve their access to care. For instance, one of the questions we ask parents at the drive-up screenings is whether or not their child has dental insurance. 24 families stated they did not have insurance, but our care coordinator discovered that 70% of these children already had Medi-Cal, but didn't realize it, or didn't realize that it covers dental care. Or the parents assumed that their children did not qualify for Medi-Cal since they as adults did not, which in San Mateo County is not necessarily the case for children. Those 17 children may not have gotten dental care for a very long time were it not for the follow-up care coordination efforts of Sonrisas. Another adaptation in response to the pandemic that was quite beneficial was our drive-up dental screening program, which gave us more opportunities to see older children, since our traditional on-site school screenings tend to focus more on younger grade levels. In addition to our community dental screening services, Sonrisas created new innovative programs, such as our virtual dental office field trip. This interactive multimedia module was created to educate high school students about careers in the dental field, in addition to general oral health information that they could then pass on to family, friends, and other community members. With the help of dozens of dedicated volunteers and staff members, Sonrisas was able to not only meet, but surpass most of our outreach goals during this unpredictable year. Sonrisas Dental Health is so grateful for the support we have received from individual donors and organizations that have supported our outreach programs this year. Without them, we would not have been able to help those in our community who need it the most during these challenging times. Thank you all.